start recording as well. Okay. Great. So we are your two moderators here today to talk to you about universal healthcare. I can start. My name's Kelly Flannery. Hi, everyone. My long title is the If, When, How Reproductive Justice HIV Fellow, but really I'm just PWN's legal fellow over here. My pronouns are she, her, hers, and I'm very excited to be with you all today.
Awesome. Hey, I'm Brianna Diaz. I'm PWN's policy director. My pronouns are she, her, hers, and I'm super amped to talk about universal healthcare with you all today.
Over to you, Brianna.
This is me. Okay, sorry. So yeah, I'm sure many of you are familiar with what who PWN is. We are an organization dedicated to preparing and involving women and people of trans experience living with HIV, and getting them involved in all levels of policy and decision making. We are originally a national membership body of women and people with trans experience. We were founded in 2008, and we are led by our constituency. All of our policy agenda issues, we have 6 of them, all of those were decided by, and we continue that work based on what our membership deems are issues that directly impact their day-to-day lives.
All right. And so for our webinar today, we have 2 main objectives. We hope you'll walk away with 2 things. One is an increased understanding of what universal healthcare is and why it's a PWN-USA policy agenda issue. So why it is that our members, among all of the issues that impact their lives, decided that universal healthcare was a core policy issue that needed to be informed by our policy team. And then we're also going to learn about the Democratic presidential candidates' healthcare proposals. Like I said a little bit earlier, we have the first primary coming up in Iowa in just a week, so every other state's going to flow after that. So we want to make sure when you head in there for primaries voting, you're informed and know what you're doing.
Yeah, so Kelly went over a little bit about like what's our mission objectives today. So we're gonna break that down a little bit more of like why are we here. I mean, it's 2020, it's an election year, and there is an entire party of candidates that is dedicated to reforming healthcare in ways that it either expands to include more people that need access to health insurance, which obviously includes people living with HIV, Black and brown people, low-income people, LGBTQ people, and immigrants, documented or undocumented. And what that looks like going forward for our country varies dramatically candidate to candidate. And so, we're here today to talk about, what is universal healthcare to PWN and what it means to us and how should it look. We are then going to take that analysis or that structure and use it to look at our candidates' healthcare proposals.
Okay, awesome. And I just want to begin this presentation with acknowledgments and appreciation. Katie Robbins from Campaign for New York Health came on a PWN webinar just about a year ago. It was also our policy agenda webinar series on universal healthcare. And she came on and talked about Single Payer 101. And a lot of her slides helped inform this presentation. So I hope you all, if you're interested in what we're talking about, will go back and watch that webinar to get a deeper understanding of some of the issues behind single payer. And we'll also just check out Campaign for New York Health. They have a great resources around the state-specific campaign to try and get universal health care in New York State. All right, and with that, I am gonna start by giving us some key terms in the US context. If you've ever been on a PWN webinar, policy webinar specifically, or been on a policy call, we may have thrown around these terms without necessarily defining them. And that's because they're pretty key terms whenever you're talking about healthcare in the US. So we're gonna pause for a moment, step back, and define them. So the first term I wanna talk to y'all about is public health insurance. So this is exactly what it sounds like, right? It's a program or system where people who are eligible have some or all of their healthcare costs covered by the government. So it's health insurance that's funded by a public entity like the government. And generally it's run or regulated by the government and funded through taxes. All right, from there we're gonna get a little more complicated because we're gonna talk about different forms of public health insurance. And so the first one I want to go over with y'all is Medicare. When I first started out in this space, I got Medicare and Medicaid confused all the time. And I want to give you one like really quick trick to differentiating them. Medicare has an R in it, and so it's generally for people of retirement age. So what is Medicare? It's the federal health insurance program that was created for people ages 65 and over. This is regardless of income, medical history, or health status. It also covers certain people under the age of 65 who have a long-term disability. Medicare plays a really key role in providing health and financial security to 60 million older people and younger people with disabilities. The program helps to pay for a number of services, medical care services, including hospitalization, physician visits, prescription drugs, preventive services, and more. There are 4 parts, A, B, D, and C. And yes, I put those in that order for a reason. We're not going to go deeply into them, but you may have heard someone talk about Medicare Part D, and that's because they're talking about coverage through Medicare for outpatient prescription drugs. The reason Part C is last is because this is a program that allows eligible people to enroll in a private health care plan and receive all Medicare covered Part A and Part B benefits, and sometimes Part B. So it can kind of encompass all of them. But we can put the stickiness of that away for now, because what I want to talk to you a little bit about is that Medicare can be really expensive. It has pretty high deductibles and cost sharing requirements. So that means that people have to cover some things that insurance doesn't. And it also places no limit on out-of-pocket spending for services covered under some of the parts. It doesn't pay for everything. For example, it doesn't pay for some of the services that are really important to older people and people with disabilities, including long-term services, supports, dental services, eyeglasses, and hearing aids. And because of this, most of the Medicare beneficiaries that are covered under traditional Medicare also need some kind of extra insurance coverage that helps them cover costs and fill those gaps. All right, now let's talk a little bit about Medicaid. As it says on the screen, Medicaid is the nation's public health insurance program for low-income people. It requires that states cover certain groups of individuals. This includes low-income children and some of their parents, pregnant women with low incomes, and certain low-income seniors and some individuals with disabilities who are under the age of 65. It's also the primary source, a principal source, of long-term care coverage for Americans. Most people, the vast majority of people on Medicaid would otherwise not have access to affordable health care. So it's a really important aspect of our public health care system. The states aren't allowed to charge premiums for people with really low incomes, so it's really important for folks who might not otherwise have enough money to be able to afford to pay out-of-pocket costs. And it has to limit cost sharing for some services and people. Research shows that folks who are on Medicaid have far better access to care than uninsured people and are less likely to postpone or go without needed care because of cost. The coverage of low-income pregnant women and children has also contributed to a dramatic decline in infant and child mortality in the US, but trust me on this one, we still have really far to go on that issue. And so the last thing that I want to mention about this is that it's a state and federal partnership. What that means is that Medicaid is paid through joint funding, both from the state and federal government. So basically for every dollar that the state puts in, the federal government has to put in some amount of matching funds. It differs depending on the state. And then the state runs the Medicaid program, but it's subject to certain federal standards. Within those federal standards, states have a lot of flexibility to determine who they're going to cover, what services they're going to cover, how they're going to deliver health care, how they're going to pay physicians and hospitals. And then they can even ask the federal government if they can change some of those standards that the federal government has already set. So the state really has a lot of leeway there. And with that, I'm going to pause, because we're going to stop and do just a little bit of a poll. So for our folks who are on their computer, I am going to put up a poll. So go ahead and answer the question on the screen. The question on the screen is, What is the public health care program that primarily serves people with low incomes and specifically requires coverage for low-income children, low-income children and some of their parents and pregnant women? You got 20, you have about 30 seconds left. All right, it's time for a hint for folks who haven't guessed yet. This is a state and federal partnership with joint state and federal funding. Another hint, the state runs the program with a lot of leeway, though there are certain federal standards that they have to meet. All right, you got 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Poll ends. Now I have to share this with 100%. Very good, everyone. All right, so we're gonna have one more poll coming at you. See how we did going over the terms. What is the federal healthcare system that primarily serves people ages 65 and over and certain people with long-term disabilities? All right, you have about 30 seconds left. Hints coming at you. This program has 4 different parts. Hint coming at you. Part D covers prescription drugs. It can be very expensive for people who are beneficiaries. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. End poll. Again, with 100%, that is Medicare. Very good, everyone. Thank you for playing along. All right, let's move on. Let's talk a little bit about the Affordable Care Act. The Affordable Care Act is a law that was signed into law by then President Obama, and it's the most significant overhaul we've seen of the US healthcare system since Medicare and Medicaid were passed in 1965. It extended healthcare coverage to about 32 million uninsured people by expanding both private and public insurance. The law was passed in 2010, but key provisions, and we're going to go over some of the really key things that happened, actually went into effect a little bit later. So let's talk about some of the things that the Affordable Care Act did. I'm not going to go over all of them because we don't have quite enough time for that. But basically, a couple of the things that it did are that it required employers to cover a certain number of employees, to offer them health insurance coverage and incentivize smaller employers to do the same. It explicitly prohibited discrimination based on race, color, national origin, sex, age, and disability, making the ACA's civil rights provision the first federal civil rights law to prohibit discrimination based on sex. And it was made clear through regulations that sex includes sexual orientation and gender identity. It also created the individual mandate, which required most people in the US have health insurance, although that individual mandate was actually zeroed out by Congress in 2017. Another huge thing that it did was it created the essential health benefits requirement. This required that health plans cover a comprehensive set of services, including preventive and wellness services, prescription drugs, hospitalization, maternity and newborn care, and more. And these essential benefits had to be covered with no annual cap and limited cost sharing, had to be covered with non-discrimination protections, cover a network of cover emergency services without prior authorization or additional out-of-network cost sharing. It also stopped insurers from charging people more or denying them coverage because of a pre-existing condition. So previously, if someone had a health problem before the plan kicked in, insurers could either deny them coverage or charge them more for that. And the ACA, one of the huge things it did was stop that. 2 other huge things that the ACA did is what we're going to talk about a little bit, and that's Medicaid expansion and created the ACA marketplace. All right, so what is Medicaid expansion? This is really a central component of the ACA. Initially, the ACA would have expanded coverage to people with annual incomes below 138% of the federal poverty line, which sounds complicated, but in 2019, that would have meant people who are making less than $12,490 for one person, or if a family is making less than $25,750. But then SCOTUS, the Supreme Court, stepped in. And so now basically states have the option of whether or not to expand their coverage to cover more people. 37 states have done so, have expanded their Medicaid program to cover more people, those at or below 138% of the federal poverty line, and 14 states have not. Medicaid expansion covers groups of people who were left out of public health coverage before. So people like folks who are low-income, able-bodied parents, low-income adults who don't have children, and this includes a lot of people living with HIV, and even just people who struggled to maintain well-paying jobs but didn't meet the disability standards for Medicaid. If a state chooses not to expand their Medicaid program, the federal government can't take away Medicaid dollars that a state already receives, but what it does do is incentivizes states to expand. And it does that by paying a vast majority of the cost related to the new people who are covered under Medicaid expansion. Medicaid expansion ultimately means coverage gains, sharper reductions in racial disparities in uninsured rates and health outcomes, better access to and more affordable care, and less rural hospital closures. All right, the ACA Marketplace. So the ACA Marketplace is a place where people can compare, shop, and enroll for health insurance that's affordable and ACA compliant. When I say ACA compliant, it means all of those protections that we just talked about under the Affordable Care Act, like protections for people with pre-existing conditions and covering essential health benefits, all of that has to be included in those plans. The plans also can't include any lifetime or annual risk limits and caps on cost sharing. So basically what this does is it makes sure that health insurance companies can't say, oh, you've spent as much as you can in healthcare and you're responsible for the rest. So none of those annual caps. They're also created, the ACA Marketplace also has tax credits available. And these are subsidies that are intended to help people who are between 133% and 400% of the federal poverty level. It ensures that they can help afford a plan. And so with that, we will pause and we have our second polling ready for y'all. All right. And launch poll. All right, I'll give everyone 1 minute to answer this, and then we will move on. So the question is, through the ACA, states could choose to cover nearly all adults with incomes at or below 138% of the federal poverty line through their Medicaid program. 37 states have done so. What is it called when states do this thing? All right, answers are coming in quickly and frankly, very accurately. All right, everyone, I'm gonna give you 10 more seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So we had very strong answers on that one. The answer is Medicaid expansion. So whenever you hear someone talking about expansion, you're talking about the states that chose to expand their Medicaid program with the federal government helping to defer the costs. All right, so now we're going to talk about a little bit about what PWN means when we talk about universal health care. So universal health care can mean a lot of different things, but a very basic understanding is that healthcare coverage is universal. Everyone has it. PWN's definition is sort of our star in the sky. This is what we want to see when we're talking about universal healthcare. So we want to see that everyone's covered no matter who they are. So regardless of race, gender, immigration status, healthcare needs, past or future, or their ability to pay. Everyone has to have access to high quality, non-stigmatizing, culturally competent healthcare, regardless of, again, like race, gender, immigration status, all of those things. Coverage has to include services that are necessary to achieve physical, emotional, and mental health. And this includes the gamut. So hospital visits, primary care, medical devices and lab services, mental health care, and much more. Free choice of hospitals, doctors, dentists, nurse practitioners, etc. No financial barriers to care, including no co-payments or deductibles. Equitable, quality healthcare systems. So this includes rooting out things like racism and gender bias that are built into our current healthcare system. And finally, fair, progressive public financing. We're going to skip the next polling because we're running a little short on time. So getting to universal healthcare. The US is the last among countries with advanced economies to not have a universal healthcare system, but there's a lot of different ways that states have gotten there. So I'm going to quickly go over just a couple. This is not exclusive, and often nations sort of mix a couple of these features, but these are sort of three broad buckets that you can think of when you think of how is universal healthcare achieved. And so the first is a regulated system where the government regulates the private healthcare market, and people are required to buy some level of coverage, generally through an individual mandate. So the US almost had that individual mandate until that was zeroed out. Everyone who's required to have insurance, so everyone under that mandate, is covered unless they qualify for an exception. And then services are generally delivered through private healthcare industry with government regulation, for example, by defining the benefits that have to be covered. So the Netherlands is an example of this. There's the two-tiered system, which is mixed public and private insurance, where the government finances a core set of services that all residents are covered by, and then people can buy additional private insurance coverage over and above what the government offers. These services are delivered through the public and the private sector. And then finally, PWN's favorite is single payer. This is when a single public or quasi-public authority, generally this means the government, finances healthcare. All residents are covered for a core set of benefits, so things like primary care, annual screening, medically necessary services, all of this without cost sharing. And then services can either be delivered exclusively through the public sector, or there's also possibility of private sector involvement. So this is something like what the UK has. Now, just pause here for a little bit to say, in the US, we have not met PWN's vision. Like I said, we're the only nation with an advanced economy that does not have universal healthcare. And in fact, we don't even really have a healthcare system. We have healthcare systems. Healthcare coverage in the US is fragmented and impressively complex. There are multiple payers, there's private and public sources, and wide gaps in insurance rates across the US. A majority of people are covered through private insurance, which can be profit or not for-profit or non-profit. Plans are regulated on the state level, so that varies widely as well. And all of this to say, I'm going to cut it short because Brianna's going to talk a lot about problems in our healthcare system. But all I want to say is this is not normal. This is not necessary. In the next couple of slides, I'm going to quickly show you how the US stacks up to other industrialized countries with advanced economies, and it's not great. So first off, we're paying the most. The US spends more per person on healthcare than all other industrialized nations with advanced economies by a considerable margin. We also spend the most on drugs, more than double the average of comparable countries. We are getting less. So compared to other countries, people in the US have the second lowest likelihood of seeing a doctor when they need one. The US has dismal avoidable mortality rates, considering how much we spend on healthcare. We have one of the highest maternal mortality rates of industrialized nations, and that rate is rising in the US as it declines everywhere else. And despite spending the most, the US has one of the lowest percentages of people with healthcare coverage. We're also paying the least for a defunct system. A study last year found that 2 out of every 3 people who file for bankruptcy cite medical reasons linked either to the illness or their time off for the medical bills. Another study in 2019 found that about 1 in every $4 spent on healthcare in the US is wasted. That's at least $760 billion every year. The biggest source of this waste is administrative complexity. So the time and resources that are devoted to billing, coding, and reporting to insurers and public programs. Ultimately, what this report shows us is not only does the US spend more on healthcare than any other country, it also wastes more. And so this is why PWN is looking to single payer as our star in the sky for universal healthcare. And with that, I'm going to turn it over to Brianna to dig even deeper.
Awesome. Thank you, Kelly. And thank you for everyone for interacting with our poll. We really like quizzes, so thank you. So yeah, I'm going to talk about 2020 presidential candidates and their healthcare proposals. So yeah, I'm sure we've heard a lot about this. There's already been several debates, and a lot of them do cover healthcare, but their plans may not be super easy to understand, and that is intentional. Health insurance is so complicated in this country because, you know, there are some corporate interests in that, and maintaining profits and maintaining power, and, you know, maintaining systemic barriers that keep certain people out of getting the help and care that is required. So yeah, we're going to talk about that. Click. Yeah, so why is healthcare so important in this election? Do you ever feel, I don't know, I sometimes feel like we're talking about healthcare a lot more than we have previously. Like, it's always been a discussion, it's always been a point, but it's like, that is the point that people are getting hammered on the most, is healthcare. And, you know, we know why. The facts are is that right now, like, there are 27.5 million people who do not have health insurance, and that does not include undocumented people. We know that a majority of uninsured in America are low income and people of color. We know that 45% of uninsured adults are saying they don't have health insurance because of the high cost of health insurance. Next. Why else do we care about, you know, health insurance selection? Well, I'm sure our PWN members are fully aware that the Trump administration is constantly attempting to roll back our health care. We fought tooth and nail back in 2010 to get the Affordable Care Act, or Obamacare, just to get it to where it is right now. Not the perfect model, not the ideal model, but inching us closer to the universal health care like gold standard, as Kelly mentioned. We've seen administrative rulemaking by this administration to kick, or to redefine what non-discrimination is. To say transgender people and people who have had abortions, you know, doctors and healthcare providers allowed to discriminate against them. That makes no sense. There's plenty of lawsuits, as we've seen, challenging the constitutionality of the ACA. We are seeing that right now in the Fifth Circuit of whether Obamacare can exist. And we've also seen congressional action, which is this really cool photo of our PWN members who went to DC to tell Congress, keep your hands off my healthcare. So by all the progress that we have made on making healthcare more accessible, we've seen this current administration do everything in its power to roll all that progress back. Next. So another reason why this might be so important, or healthcare is so important this election, is because there's been so much talk that the ACA doesn't go far enough. I'm sure a lot of you remember back in 2010, 2012, when the ACA was nothing but a bill before it was law. There was a lot of debate, a lot of discussion, and a lot of community mobilization around what healthcare should look like in America. Unfortunately, the individual mandate, or like the public option, did not make it past a bill. It didn't make it into law. And that has had real impacts and consequences on a lot of people, particularly people living with HIV, LGBTQ people, low-income people, people of color, etc. And we do know that under the ACA, a lot of states did not accept the Medicaid expansion, which cut off access to healthcare for populations that desperately need that. And so it's these Democratic candidates that are trying to now focus on healthcare reform to address these three issues. Next. So first, I'm going to go over Medicare for All. I'm sure you've all heard this a lot or have seen these signs. So I'm gonna go over a lot of these plans at a very, very high level. I can guarantee you that breaking down the minute specifics of each healthcare proposal would take probably a whole day for each plan. So we're just going to go over the top level stuff. All right. So go ahead, Kelly. Thank you. So the basics. What is Medicare for All? You keep hearing that. What does that mean? Well, the basics is it's a single payer system. Kelly defined that earlier, and I'm going to go over it again, is that single payer system is everyone in this country receives comprehensive healthcare coverage regardless of their ability to pay. everyone gets health insurance under a single payer system. How does that happen? Where does that money come from? Well, it's funded by our taxes, which is a whole fun discussion about what kind of taxes and how much goes into funding this. But that's the basic idea of a single payer system, is that we eliminate private insurance. So that's private health insurance from your employer. That can just be private health insurance that you buy separately yourself. Instead of that, the government, the federal government, offers health insurance to you. It comes with, it offers a healthcare plan, and those plans are funded via our taxes. It's a single payer system. Under the single payer system, under Medicare for All, you have comprehensive benefits. You have the same benefits that you do under the ACA. And sometimes those benefits are expanded based on whose proposal we're looking at. One big flag is that there's no premiums and no deductibles or co-payments under this Medicare for All plan, which can mean a lot for a lot of people. Health insurance is expensive. Even if you have insurance, sometimes you still have a lot of high payments that you have to make just to get the access and services that you need. So under Medicare for All, who is covered? All right, it's children, it's adults, it's the elderly. The plans that we'll go over that Senator Bernie Sanders and Senator Elizabeth Warren have introduced actually has really inclusive non-discrimination within it. That means that undocumented immigrants can have access to Medicare for All or the single payer system. It explicitly codifies non-discrimination to include sexual orientation and gender identity. That is so important. And it also says that people who've had abortions cannot be discriminated against in healthcare services. Next. So yeah, as I said, who supports this plan? It's Elizabeth Warren and Bernie Sanders. There are differences between their two plans. They both embrace the single payer method, that is, get rid of all private health insurance and replace with a government plan. However, how long it takes to roll that out, how is it paid for, those things do vary candidate to candidate. So for example, Bernie Sanders has introduced legislation to make Medicare for All a thing, and the impact would be immediate. It is, hey, if we pass this bill, it is signed into law. President Bernie Sanders will sign it into law in my first 100 days, and we will radically change health insurance out the gate. Elizabeth Warren says that she will for her plan, she will alter, health insurance. She will move towards a single payer option within 100 days, but it would take up to 3 years to fully implement that. So that would be some people get on Medicare for now, but maybe some of us wouldn't be able to access that and might have to remain on our private health insurance for another 2 years or so. So those are the kind of details to consider. Next. All right, so now I'm going to talk about Medicare for All who want it. This is another big buzzword in the election, and I'm sure we've heard a lot about it. So next. So what is Medicare for All who want it? And this is a really fun one to explain. Basically, it is the public option. What that means is that it is not a single payer system, right? It is just expanding the already existing Medicare or Medicaid. It is expanding who has access to it. It is expanding, into the states that have denied Obamacare expansion. It would say, hey, public option's kicking in, North Carolina, now you can have access to this. That's kind of what the public option is. And under this plan, it is automatic enrollment into that public option for some, not all, just for some, mainly the uninsured people, people who do not currently have health insurance. You would be automatically enrolled into a public option under this Medicare for All for those who want it plan. Again, it does not replace the private insurance model at all. If you have insurance through your employer, you can keep it if you want it. Another thing to highlight is that it eliminates the Hyde Amendment. And what that means is that there is this act, the Hyde Amendment, that prohibits federal funding from going to paying for services related to abortion. And abortion, right, stupid or just not a great law. And so this healthcare plan would completely eliminate that, freeing up federal funding to go to abortion-related services. Who is covered? Children, adults, and elderly. This one isn't really clear on undocumented immigrants. It says they may buy into it, but how that is possible for undocumented immigrants, especially because health insurance will still be expensive. We're not super clear how that will benefit undocumented immigrants in practice. And then with an inclusive non-discrimination, yes, that is what's being told by this candidate who supports this plan, but I haven't seen that in writing, but we'll see. Next. So as you may know, this is Mayor Pete. This is his plan. He is the Medicare for Those Who Want It guy. So this is your candidate if you like public option. Next. I'm going to really briefly go over the other candidates' proposals because there's so many. So we're just going to really briefly go through that. Go ahead, Kelly. So Joe Biden, what's his deal? So he also supports the public option. So we're not replacing your private insurance. You can keep your employer insurance. You can just pay for your own if you want through a private insurance company, or you can have a public option. His plan would be open to everyone. That means that you don't need to qualify for Medicare or Medicaid, as Kelly, defined it for us earlier, to buy into the public option. If you think the public option is better than what your employer is offering you, you can buy into it. Senator Biden has been marketing or talking about his plan as building on the ACA. He was vice president during the Obama administration. He worked a lot on the ACA, and it is his idea to build on the ACA to make it better. And his version of making it better is providing the public option, a broader public option than the one that failed in the ACA back in 2012. And it too eliminates the Hyde Amendment, which is incredible because Senator Joe Biden actually used to support the Hyde Amendment. And so this is a really positive move forward for him to incorporate that into his healthcare plan. Next. Senator Amy Klobuchar. So she also has a public option that would expand Medicare or Medicaid. So what that means is that we keep Medicare and Medicaid, but we just expand who qualifies under that. As I'm sure many of our members know, it can be really difficult to qualify for Medicare or Medicaid and then to stay on it year after year. Through her public option plan, it would expand the group of people who can receive health insurance through this program, right? Again, this one does not, it doesn't replace private insurance. You can still have your employer private insurance. And her wording has been that her healthcare plan will improve the ACA, I guess via that public option. And she, on her healthcare platform, she focuses a lot on lowering the cost of prescription drugs, which has always been something Senator Klobuchar has talked about. And she does have a focus on reproductive rights within her healthcare plan too. That's saying, access, that women's health must include their reproductive rights, which means like access to abortion, access to birth control, etc., and that her plan would incorporate those things. Next. So we made you this really fun spectrum, this thing to look at to be like, okay, wait, you told me there's 2 people that are Medicare for all and that there's no more private insurance, but I can buy the government. But then there's these 5 or 6 other people and they have a public option and each public option is different. Yes, they each have their own stance on our healthcare proposal. And so we tried to make this really cute graph for you all to show that Elizabeth Warren and so Senator Warren and Senator Sanders are the only 2 candidates proposing a single payer system. The rest of the candidates, we have Tom Steyer, we have Andrew Yang, we have Senator Biden, Mayor Pete, and Senator Klobuchar. They believe their healthcare plans incorporate a public option. Each public option is very different on how expansive it is. Are you required to enroll? All of that varies and is very complicated. But I think one shining point to make is that none of them endorse just the private model. every single candidate, I think a lot in part due to, you know, community mobilizing and organizing, is saying, we need to broaden access to healthcare, and that requires a public option. That requires our government moving more towards universal healthcare. And that is the central tenet of every single platform, which is, I think, inspiring. Next. So why are we talking about all this? I mean, it's important, but also Super Tuesday is coming up. It's March 3rd, 2020. I know we have OFP members on this thing. I see some of y'all. I know we have members that are here that live in one of these states. And so, you know, bear in mind, if you live in one of these states, your primary is March 3rd, 2020. And when you're going into the poll to vote for who you think should be the candidate of whatever party you're voting for, you know, consider these healthcare proposals. One of many issues to consider when going to the polls to cast your vote. Next. So we went over a lot, and we know this is very complicated. We know that it requires longer discussions, and so we have provided some resources for y'all to check out. PWN did have a webinar and a fact sheet produced last year on universal healthcare. So we recommend, you know, you take the time to watch it, read that fact sheet if you'd like to know more. You can also check out our website to look at our policy agenda, which includes universal healthcare, for more information on that. Next. And then we have other resources that we wanted to advertise, and we are happy to share this with you all. We know you can't just like click it and share it, you know what I mean? Like if you email us, we will email you back with all the resources you could dream of. And so with that, we have 15 minutes left, and we are going to open it to questions.
All right, everyone. So we wanted to leave ample time for questions because I know that it's a lot to try and digest healthcare. So I'd encourage you to put your questions either in the chat box, or I'm going to open up the presenter or the participant list right now. If you raise your hand, I can unmute you, and then you can feel free to join in. So with that, I will stop talking and let the questions start flowing.
Okay, I see one question in the chat box from Crystal, and it says, if elected, how much power does the presidential candidate have to enact their plan? Really good question. In short, a candidate can have a plan, right? A healthcare plan. But if it's a bill, both the House of Representatives and the Senate have to pass it, majority vote, before the president can sign it into law. So that's definitely been a lot of conversation around some of the more ambitious or progressive Medicare plans. Is like, cool, you know, President Progressive, like, thank you so much for getting this Medicare for all bill, but like, you have a Senate that's not going to vote in favor of it. So like, is it really going to happen? Fair question. I think it depends, right? It depends on who controls Congress, or who is open to having a discussion on this issue. But it's more than just the candidate's decision to pass these kind of laws.
Yeah, and Vanita wrote in the chat box, note ACA repeal attempts, and that's right? Even once you pass the law, it doesn't mean that it's safe from other attacks. So for example, with the ACA, we see the Trump administration slowly chipping away at who can access coverage, what is covered, specifically targeting people who are trans or gender nonconforming, people who need abortions, specifically making it harder for them to get services they need. And so once you enact a law, which is hard enough in and of itself, then you have to continually fight for it. And maybe you fight to push even further forward, right? Imagine the future possibility of how we can expand coverage. But yeah, it's hard, and it's why it's so important to concentrate on congressional elections as well as the presidential election. So Vanita asked, what does the polling say about how Americans feel about universal health care coverage? Which is a great question. And actually a majority of Americans support universal health care coverage, which isn't surprising. Healthcare is a human right, and it's something that we all experience needing at one point or another. And so there's actually a lot of political and public will behind it. The question is how we're going to craft a bill and get it through Congress and get it signed into law. How about other questions? I have a question for you, Brianna. Oh, please explain single payer again, who supports this?
Okay.
Nona. So let's go back to that slide and then you can talk a little bit about it.
One more. Yeah, cool. So single payer means that rather than having private health insurance, so, you know, rather than having private health insurance, the government, so like the US government would be the sole provider of health insurance for you, right? So think of it like, I guess one of the most simplistic ways to say it would be like everyone's on Medicare. Like if if you're on Medicare or Medicaid, you have a government health insurance ID, and you use that to go to see your doctor, you go that to fill your prescription, like everything exists from the government. There is no more private health insurance whatsoever. So as I put here, the single payer system is that everyone receives comprehensive coverage regardless of their ability to pay, which is a huge issue right now since our current healthcare system is set up to be rather expensive. Like I said, the uninsured rate is at least 27 million people, and 45% of those people said, I just can't afford health insurance, which is why I don't have it. And the idea behind single payer is that's not a problem anymore. Like you will get health insurance because you have paid for it via your taxes. So you have access to health insurance. And that single payer system, click, is endorsed and is used in the healthcare proposals of Senator Elizabeth Warren and Senator Bernie Sanders. So they are the Medicare for all people. That's probably what you might hear a lot in the debate and in campaigns.
So there's a follow-up question here about, so would my Medicare go away? I would have no say to keep Medicare.
I wouldn't necessarily say that you would lose it or that you get no more say. The programs still exist from my understanding. It's just broadening who has access to it.
And then we have a comment from Tammy that is, I agree single payer would be best, but the devil's in the details. Right now with Medicare for all plans, however, eliminating private insurance, many hospitals will close in rural areas. Rural area hospitals depend on private insurance, which pays higher reimbursement than Medicare. One of the interesting facts that we found about Medicaid expansion is states that have expanded Medicaid actually have slower rural hospital closures because a higher percentage of the population gets covered. And then hospitals are better able to defray costs by having more covered care. So I don't know if you have any more sort of specifics on that, Brianna.
No, not at this moment.
Okay. But thank you for that comment, Tammy. And then we also have a question from Patty is, have the candidates provided ideas for how they pay for their proposed plan, no matter what it is?
Yeah, they have. And I think that is where the most complicated discussion starts. It's, who gets taxed? What group of people? The middle class, like the 1%, the 0.01%, do they have a higher tax in order to pay for this, right? Like we've heard a lot about how certain healthcare plans, especially the Medicare for all ones, could arguably cost, $30 trillion, which is a lot of money. And it's like, how do we get that? And I think if you all, if you're wondering what those structures look like to pay for these healthcare proposals, there are materials out there that break down this very complicated taxing mechanism or taxing structure, but that requires a much larger conversation than I think we have time for, which again, if you want more understanding of that, definitely email Kelly and I so we can set up a time to talk with you about that. Or if we need to have a follow-up webinar on that, we can make that happen.
Awesome. And then Vanita asked, this is a really good question, is how should folks be analyzing different perspectives on universal health care or Medicare for all? It's hard to distinguish between the different candidate platforms. I think that's a great question, and it's part of the reason why we're here. I'm gonna let Brianna, do you have anything you wanna say about it?
So, yes, it is hard to distinguish between the different candidate platforms because healthcare is hard and confusing. I think a lot of the ways you can break down about how each proposal is different is there a single payer option? If not, then you're looking at the candidates with the public option, right? And the public option between each candidate is entirely different. It is entirely different. No one proposal is copy and pasted into with another candidate. So when you're assessing the candidates and what kind of healthcare system you would like to see in America, I think starting there, who does the public option include, and then how is it funded is a great starting point. And with the single payer system, do I support a single payer system? Step one, and then two, how is that paid for? And then how long does it take to implement? Because each plan is so different.
I totally agree with that. And I'd throw in that at PWN, we always use sort of a human rights grounding when we're doing our analysis. And we also make sure that when we're analyzing policies, we do so through the lens of racial justice and gender justice, reproductive justice and economic justice. And so this means looking at how who is actually going to be impacted, and really deeply questioning whether these plans are trying to disrupt the structures of oppression that have been keeping folks out of the care that they need and perpetuating the same structures of power and access. And so as you're analyzing the plan, like Brianna just said, keeping an eye to how comprehensive they're going to be and who is going to actually be covered, I think is a good way. And so we have another comment. Either way it goes, this will not happen overnight. Sounds more realistic with a 3-year plan, from Jesse Mona. I do think that keeping feasibility in mind is another great mode of analysis. Do we have any other questions out there? I guess let's leave with a couple of closing thoughts. Mine are, thank you so much for joining. I'm so excited that the conversation about universal healthcare and single payer is as real and tangible as it is right now. It's complicated. Insurance is very hard in the US. It's unnecessarily complicated and there's a lot of waste. And these plans are trying to really get at that. So it's difficult, but I'm glad you all were here to join us, and we are imagining a better future tomorrow together, one that actually supports human rights. Brianna, do you have anything you want to add?
Yeah, no, thank you so much. Thanks for, being on this webinar and wanting to learn more about health insurance, learning about universal health care, and wanting to understand your candidates' proposals better. I just want to leave with March 3rd, Super Tuesday is coming up. It's so important to have your voice heard, especially this election. So yeah, I look forward to see what we all create together in this new administration, hopefully. Yeah, thank you.
Thanks, everyone.